Scenario: Mr. Wilson is a 71-year-old man with a background of COPD for which he is taking steroids. He developed perforated viscous and acute renal failure with hypokalemia. Task: call the ITU registrar to seek advice and inquire about the availability of an ITU bed. Hello, I am Dr. Ahmed. A clinical fellow here. I would like to speak to the ITU registrar for guidance on a recently admitted unwell patient needing a laparotomy. Additionally, I'd like to coordinate a post-operative ITU bed. May I confirm that I'm speaking with the ITU registrar? Yes, you can call me Allison. Summarize your case. Mr. Wilson, a 73-year-old patient with COPD, acute renal failure, and perforated viscous. Clinically, he exhibits severe abdominal tenderness, distension, hypotension, tachycardia, and metabolic acidosis with a high lactate. His blood tests revealed hypokalemia, elevated creatinine, and a 2-unit drop in hemoglobin. Imaging shows free intraperitoneal fluids on ultrasound and clear CXR. What medication is the patient taking for COPD? The patient is on steroids. Any plans regarding the steroids? Yes, I'll administer 100 mg AV hydrocortisone as induction. Was an ECG performed? I'm not sure. I will check and update you. If available, what findings are expected? Hypokalemia manifestation and possibly AF. What about fluid balance? Any charts taken? No charts were available. The plan includes fluid resuscitation with 1 to 1.5 L Hartmann for 1H and inserting a urinary catheter for monitoring. How will you monitor his response to fluids? By monitoring heart rate, blood pressure, capillary refill, urinary output, and mental status. Was a urinary catheter inserted? I'm not sure, to be honest. I will double check and let you know. Who else would you contact? Anesthesia registrar and the general surgery consultant. Your patient has COPD. Did you check his O2 level? Unfortunately, no, but I will do that immediately after the call and let you know. How you will give O2 therapy. I'll use a venturi mask or nasal cannula at 4 lmn to maintain SpO2 between 88 and 92%. If mentioned in the file, 28% O2, I'd increase to 35%. Why this approach? To avoid respiratory depression, as her respiration is driven by hypoxia. Will you repeat ABG after giving O2? Yes. Did you give antibiotics? Not yet, but I'll take a sample for CNS, follow trust protocol, and consult with a microbiologist for the appropriate antibiotic. Do we need to give the patient more blood because his hemoglobin is going down? Blood grouping, cross-matching, and consultation with a hematologist and anesthetist for further advice. What is treatment of AF of this patient? Correct underlying cause and addressing electrolyte disturbances. Is ICU admission necessary? Given COPD and renal failure, ITU care is needed. What if only one ITU bed is available and an asthmatic patient arrives first? I will continue monitoring the patient in the recovery room until a bed is available. Is the surgery risky? Yes, it carries significant risk, but it's urgent and necessary. Preoperative optimization is essential. Summarize the discussion in management: administering fluids, inserting catheter, optimizing steroids, providing O2 therapy, monitoring ABG, administering antibiotics, blood transfusion considerations, treating AF ICU admission. Necessity. Thank you for your time. Mr. Allison, pleasure. Goodbye.